Hello, my name is Dwain Harris, and I'm the CEO of the National AHEC organization, here today to present to you AHEC, the key to experiential learning for college students in the health professions. I would like to thank my colleagues, Mary Mitchell, Executive Director of the Manhattan Staten Island AHEC. She actually submitted this proposal. And Dr. Wanda Thomas, she's the Director of the Louisiana State University Health Science Center, AHEC. So the National AHEC organization is a member organization started in 1997. We represent a network of more than 275 AHEC program offices and centers. Our mission is to advocate for our AHECs, also to educate, and communication is a big piece of what we do. Here's a look at where we are across the nation. We are in 46 states. The stars represent the program offices, which are located in universities, and the red dots are the AHEC regional centers. Typically, there's anywhere from a couple to 8 or 10 AHEC centers in a state, and we cover approximately 85% of the nation's counties. So what is an AHEC? AHEC stands for Area Health Education Center. We were created by the federal government to address healthcare workforce shortages in rural and underserved areas. And here's a look at some of the ways we address those. Our programming includes AHEC Scholars, pipeline programs, which we'll talk about in a moment, clinical rotations. We support rural and underserved clinical rotations, with the idea being that students who do these rotations someday will be more likely to practice and settle in those underserved areas. We also, most of our AHECs engage in continuing education programming, providing CME and CE for the workforce there in their area. Our pipeline programs take on different forms, anything from summer camps, health career expos, mentoring and shadowing programs, pre-med education, networking and guidance, internships, pretty much anything that A, might get a student interested in health careers, and then B, might help them along their way in reaching their potential as a health profession student and eventually as a health professional. Here's a look at students who are in the Rural Scholars Program at the Louisiana State University Health Science Center AHEC program. They are pre-med students who are juniors and seniors, selected from previous pipeline programs. The program provides guidance and mentoring. These programs really are terrific because not only do the students get the benefit of the content that we help facilitate, they may sit in on a physician lecture or hear other experts speak on topics that will help them, but they also get that benefit of networking with one another to share ideas, challenges, ways to overcome those challenges, and really help each other along their way. I love this picture. Here's a look at another one of our pipeline programs. This is at the Manhattan Staten Island AHEC. This is a summer health internship program. And this is a 6-week program for college freshmen and sophomores. Here you see students learning in the gross anatomy lab of the City College of New York in Harlem. And here you see the students visiting the Touro College of Osteopathic Medicine and College of Pharmacy, also based in Harlem. Terrific experience provided for these kids. Here's a look at the Southern Kentucky AHEC's Future Docs program. This brings cohorts of, say, 5 to 7 students together from throughout Southern Kentucky. These are undergrad, these are pre-med students, and provides them with the networking that we talked about. Also things like MCAT test prep courses, as well as essay and interview coaching. And you can see some good outcomes since 2016. 16 of those students have made it into a medical school. A little bit about AHEC Scholars. It was developed in 2017 by HRSA, and we began the program in 2018. Our first cohort, because it's a 2-year program, our first cohort just graduated. So this program consists of 80 hours of supplemental education. And the key difference between scholars and pipeline programs is that with our AHEC Scholars, those students are already in their program of study, and what we're providing is supplemental education to them. And really, the idea of it, the main thing, especially with the experiential piece that we offer them, is to get them into these rural and underserved communities to see what it's like to practice and live there. You can see pictured here are scholars from Alaska, and as a part of their experiential curriculum, they assisted with what's called a baby box program to address infant mortality in rural Alaska. So they facilitated infant education and shepherded these boxes filled with newborn essentials out to rural Alaska. This gave them a firsthand look at not only the circumstances and challenges of some of these more isolated mothers, but also an idea of the rewards of meaningful community service. So the content related to the AHEC Scholars Program centers around interprofessional education, practice transformation, behavioral health integration, social determinants of health, cultural competency, and current and emerging health issues. So, it's been said that AHEC Scholars, they're ready to go above and beyond. They're taking this extra programming. Often we see them as agents of change. They're going to enter that workforce equipped to better serve these patients in these rural and underserved areas, we think, because of this sort of extra education that we've helped give them throughout their program of study. If you would like to reach out to any of us, there is our contact info. We'd be happy to hear from you and explore ways AHEC can partner with you to help the next generation of health professionals. Thank you for listening.